Hello everyone. Let me show you this great new app that's available on the Google Play Store and also on the Apple Store. It's a app that shows pediatric critical care medications with a quick calculation of the dosage. It's named the Pediatric Critical Care Quick Chart. It not only runs on your phone, it also runs on tablets also. This app is for physicians, emergency room staff, EMS, EMTs, or anyone that's involved in pediatric patient care. You download it from a free app in the app High School Sound Off. They've produced this app in cooperation with the Incredible Medical School, but the app is found in the High School Sound Off app. It is an in-app purchase at that location. Now, what the app has is multiple critical care medications for pediatric patients, and it allows you to quickly find the dose of a particular medication. The app is currently on the opening page, and you can swipe through by swiping from right to left to go through the app to see each page. But the important page is the table of content page. Now, if you simply tap the name of the medication that you're looking for instance, I will tap the epinephrine in the bottom of the first column, and you can see the app goes straight to the epinephrine page. If you tap the EP, the large red EP, which stands for the epinephrine, it actually quickly takes you back to the content page. First, let's look at the legend so that you know what each one of those quick reference boxes looks like. If we enlarge it, you can see that the large lettering on the left upper column labeled with the A is a two-letter abbreviation for the name of the medication. Underneath that is the medication dosage that's used to calculate the amount of that medication for a pediatric patient. In this case, it lists as 5 milligrams per kilogram. The box underneath that, labeled with a large H, is a standard dose shown for a patient that weighs 5 kilograms. So this patient would receive 25 milligrams IV. You can also use the solution A or B. A is 50 milligrams per milliliter. B is 100 milligrams per milliliter, and it shows that you would give 0.5 milliliters. Now, if the abbreviation, if both letters are red, the infusion time is from a bolus to 5 minutes. And it also shows you the other letter color abbreviations. Now let's quickly go and look at a medication. Let's check out the epinephrine, which we referred to. Now the yellow block refers to a PALS medication. The epinephrine also has an ET on the upper right-hand column. That means that it can be given through the endotracheal tube. Also on the bottom, there's an E, which lists this medication as an extravasation tissue damage possibility. So if you had a medication of epinephrine to be given to a patient that weighed 5 kilograms, the dosage would be 0.5 milligrams as an IV bolus. If the patient weighed 10 kilograms, the dosage would be twice that, or 0.1 milligram. So as you can see, these dosages can be calculated rather quickly in critical care situations where you don't have time to go through looking up charts or making sure that you remembered the correct dosage, particularly if you don't take care of pediatric patients often. If you press the E on the bottom right-hand column, which stands for extravasation risk, it takes you to the treatment of that. It lists the drugs that are a risk, and if you touch one of them, such as the epinephrine, it takes you quickly back to that page. You can also swipe the pages from right to left or left to right. Notice that the second epinephrine has a different color. That means that the medication is given slower. So this is a maintenance or a drip dosage of the epinephrine. If we go back to the contents, you can also see that there are, on the third column at the top, it says standard concentrations. If you go to that one, it takes you to some standard concentrations of those medications. It also has lower down vital signs, rapid sequence intubation medications, nebulizer treatments, and also compatibility of the different medications. This critical care chart for pediatric patients seems to me to be indispensable for anyone that's treating pediatric patients that need to make sure that they can remember and give the proper dosages to their patients. There are over 45 critical care medications listed. And as you can see as we swipe through them. Now you can also just press and hold your hand on the screen, and below is also a list that you can swipe through. So I hope you found this review of the Pediatric Critical Care Quick Chart helpful. And I would assume that everyone that takes care of pediatric patients would be needing this in their arsenal. It also runs on the tablet, but on your phone, it doesn't take but a couple of seconds to quickly look up a medication dose for pediatric patients. Again, this app is available as an in-app purchase on the app High School Sound Off.